And Therese and Kyle, you belong to Project What? Do they provide mentors or role models to help children?
Well, that particular program is made up of us, so we're the ones that go out and we provide support amongst each other. Yeah.
Mm-hmm. Okay, I guess the next question is for Kyle and Therese. The way the prison system is set up, it's almost impossible for children to see their parents on any kind of regular basis because prisons are so far away. They're in remote parts of the state, hundreds of miles away. Do you have any ideas for strengthening ties, for maintaining healthy relationships with parents who are incarcerated?
Well, I believe that it was kind of difficult from my personal experience because of my situation with my father. I didn't necessarily want to visit him, but I did visit him sometimes. And I think that it doesn't really matter about how many miles away it is. Just having a parent not in your home is really hurtful. I mean, to know that they're behind the bars, that they're somewhere else and you can't see them how you'd like to see them. You can see them across from the glass, you can see them across from the table without touching. They're not in your life anymore. I think that, I mean, keeping the connection between the parent and child, I think that if my father, I don't know, it's a bit off topic, but if my father had certain rehabilitative services, if he had someone help him, then he wouldn't have hurt me, and we could have had a closer relationship. And of course I would have wanted to visit him, but if he had that, I wouldn't have to visit him because he'd be right there at home with me.
Going along the whole rehabilitation part, I never seen my dad either throughout his whole time, but I felt like it was just kind of weird when I was young, the fact that he'd always get locked up for the same thing over and over again. So, I mean, obviously it didn't help him. What eventually helped him was when he got out the last time going to church. But just having some sort of guide for him personally to help with his addictions would have helped the family. And when you help, yeah, it is like incarceration is an intergenerational cycle that occurs. And in order to stop that, you have to start with the family. You have to help the father with whatever addiction he has and work with the kids as well, because you can help the dad, he can come back into the family, but if the kids are still broken up, still torn, still hurting from what had occurred, then if there's no healing with that with the children, then it's just going to keep going.
Yeah, that's true.
Okay, Kyle, Therese, Corinne, I'd like to thank you all for sharing your stories with us. They were very moving.
Thank you.
I'd like to move our discussion to focus on people who are coming out of prison and their efforts to reintegrate. As we all know, California has one of the highest recidivism rates in the country. Over 70% of ex-offenders commit new crimes and return to prison. Reentry programs that provide drug treatment and counseling, housing, job referrals, educational and job training opportunities, these can all be critical in turning ex-offenders' lives around and turning them away from a life of crime. And in this part of our panel discussion, we're going to talk about substance abuse and other health issues. And I'm going to address my next set of questions to three of our panelists who work with ex-offenders on health-related issues. Rudy Aguilar is with the Department of Public Health. Ronald Sanders is with the Transitions Clinic. And Kenneth Rogers is with the Senior Ex-Offender Program. My first question to all of you, what kinds of health and substance abuse problems do you see most often among ex-offenders who are coming out of prison and come to your clinics and programs asking for help?
The programs that we operate in the city are, the programs that we operate in the city are basically residential and outpatient treatment programs. So we get folks that go in and do time for substance abuse kinds of offenses. Most of them are nonviolent folks. And initially, it's a volunteer program, and treatment is volunteer. When they come out of the institution, they go in. So we provide a variety of a program. For instance, we have a residential treatment program that focuses parolees that have some kind of trade or some kind of employment situation that's almost already waiting for them. In other words, they don't have to stay a minimum of 30 to 45 days in residential treatment before they can go out and look for employment. So this is a unique program actually here in the Bay that we have in San Francisco. And then we have a residential program that it provides a variety of different individual group, but focuses on trying to get the individual acclimated back into the community. And this work is done with programs that are funded through the Department of Corrections and Rehabilitation. I must say that, in my view, substance abuse is a health issue. And so anything that's related to that, to me, is in the realm of health. One of the things that has been striking in hearing the first panel was that the Parolee Services Network, which was initially the Bay Area Services Network, which was planned back about 15 years ago, that we're still dealing with the same amount of funding. So that's got to tell you something. We're talking about reentry now, 15 years later, and they're not talking about expanding community treatment. In the 20-plus years that I've worked in the area of community treatment at the administrative level, county level, have found that those are probably your most effective programs for ex-offenders. When you allow them to come back into the community and acclimate themselves back into the community and get drug treatment, that is the best way to keep them out of the system. And those are the kinds of programs that we currently have here in San Francisco that are funded through the Department of Corrections. It was kind of interesting with the first panel that the Department of Corrections folks didn't even mention those particular programs.